What is the maximum depth for a heel stick in a newborn? A. 3.0 millimeters. B. 1.5 millimeters. C. 2.0 millimeters. D. 0.85 millimeters. Answer: C. The recommended maximum depth for a heel stick in newborns is 2.0 millimeters to prevent injury to the underlying bone. Which of the following is a reason for an arterial blood gas (ABG) specimen to be rejected? A. The sample was placed on ice. B. The sample was drawn using a 16-gauge needle. C. The sample contains air bubbles. D. The sample was collected using a butterfly needle. Answer: C. Air bubbles in an ABG sample can lead to inaccurate results and is a common reason for sample rejection. Which of the following is an appropriate action if a patient faints during venipuncture? A. Continue with the procedure. B. Call for help and monitor the patient. C. Elevate the patient's legs and continue. D. Apply an ice pack to the puncture site. Answer: B. If a patient faints, you should stop the procedure, call for help, and monitor the patient's vital signs until they recover. In which situation would you avoid using a tourniquet during venipuncture? A. If the patient has edema. B. If the patient has a history of fainting. C. If the patient has fragile veins. D. If the patient has a mastectomy on the same side. Answer: D. Tourniquets should not be applied on the same side of a mastectomy due to the risk of lymphedema. What is the main reason for performing a capillary blood collection instead of venipuncture in children? A. Easier to perform. B. Less painful. C. Less risk of injury. D. More accurate results. Answer: C. Capillary collection is generally preferred in children to reduce the risk of injury to veins and surrounding tissues. What is the correct order of draw for venipuncture? A. Red, green, light blue, lavender. B. Light blue, red, lavender, green. C. Lavender, red, light blue, green. D. Light blue, lavender, green, red. Answer: B. The correct order of draw for venipuncture is crucial to prevent cross-contamination of additives. The correct sequence is light blue, coagulation, red, serum, lavender, EDT, A, and green, heparin. How long should pressure be applied after an arterial blood gas collection? A. 1 to 2 minutes. B. 5 to 10 minutes. C. 3 to 5 minutes. D. Until bleeding stops. Answer: B. Pressure should be applied for at least 5 to 10 minutes after an arterial blood gas collection to prevent hematoma formation due to the higher pressure in arteries. What is the purpose of the modified Allen test before arterial blood gas collection? A. To check for arterial blockage. B. To ensure venous access. C. To confirm collateral circulation. D. To monitor blood pressure. Answer: C. The modified Allen test ensures adequate collateral circulation in the radial and ulnar arteries, which is critical for patient safety during arterial puncture. Which of the following is not a reason to reject a capillary blood specimen? A. The sample was collected from a finger stick. B. The sample has clots. C. The sample was hemolyzed. D. The sample was not labeled. Answer: A. Fingerstick is an appropriate method for collecting capillary blood, however, clotted, hemolyzed, or unlabeled specimens would be rejected. Which of the following conditions would result in a higher hemoglobin value in capillary blood than in venous blood? A. Dehydration. B. Polycythemia. C. Anemia. D. Hypoglycemia. Answer: B. In capillary samples, hemoglobin levels can be higher than in venous samples due to increased red blood cells in conditions like polycythemia. When collecting blood via capillary collection, which of the following areas should be avoided? A. The heel. B. The ring finger. C. The side of the fingertip. D. The index finger. Answer, D. The index finger is not typically used for capillary collection because it has more nerve endings, making the procedure more painful. How long should a tourniquet be left on during venipuncture? A. No more than 30 seconds. B. No more than 1 minute. C. 2 to 3 minutes. D. 5 minutes. Answer, B. Leaving a tourniquet on for more than 1 minute can lead to hemoconcentration, which may alter the test results. Which needle gauge is typically used for routine venipuncture? A. 16 gauge. B. 18 gauge. C. 22 gauge. D. 21 gauge. Answer, D. A 21 gauge needle is commonly used for routine venipuncture, as it is a standard size that ensures sufficient blood flow without causing excessive discomfort. Which of the following is a complication that may occur if the tourniquet is applied too tightly? A. Hemolysis. B. Petechiae. C. Hemoconcentration. D. All of the above. Answer, D. Applying a tourniquet too tightly can cause hemolysis, destruction of red blood cells, hemoconcentration, increased concentration of blood components, and petechiae, small red spots due to broken capillaries. In what situation should a dermal puncture be performed instead of venipuncture? A. For testing blood cultures. B. When testing for potassium. C. On a patient with fragile veins. D. When drawing a large volume of blood is needed. Answer, C. Dermal punctures are often preferred for patients with fragile veins, as they reduce the risk of damage to the veins. What is the first step in preparing for venipuncture? A. Applying a tourniquet. B. Identifying the patient. C. Selecting the needle size. D. Cleaning the puncture site. Answer, B. The first and most important step in any medical procedure is to properly identify the patient to ensure that the correct tests are performed. Which of the following is an appropriate response if the patient refuses to allow blood to be drawn? A. Force the patient to comply. B. Document the refusal and notify the healthcare provider. C. Leave and return later to try again. D. Ignore the refusal and proceed. Answer, B. A patient has the right to refuse any procedure. The refusal should be documented, and the healthcare provider should be notified. What is the correct angle for inserting a needle for venipuncture? A. 90 degrees. B. 15 to 30 degrees. C. 45 to 60 degrees. D. 5 to 10 degrees. Answer, B. The needle should be inserted at a 15 to 30 degree angle to ensure proper venous access without puncturing through the vein. What should be done if no blood flows into the tube during venipuncture? A. Withdraw the needle completely and try again. B. Adjust the needle by slightly withdrawing or advancing it. C. Remove the tourniquet immediately. D. Ask the patient to squeeze their hand tightly. Answer, B. If no blood is flowing, the needle may not be in the correct position, and a slight adjustment can help without the need to withdraw completely. Which of the following sites is commonly used for venipuncture? A. Cephalic vein. B. Femoral vein. C. Dorsal hand vein. D. Great saphenous vein. Answer, A. The cephalic vein is one of the preferred sites for venipuncture, particularly in patients whose median cubital vein is difficult to access. What is the purpose of inverting the blood collection tubes after venipuncture? A. To mix the additives with the blood. B. To prevent the blood from clotting. C. To help separate the plasma. D. To warm the blood sample. Answer, A. Blood collection tubes with additives need to be inverted gently to mix the additives with the blood, ensuring accurate test results. Which of the following is considered a pre-analytical error? A. Incorrectly identifying the patient. B. Misinterpreting the test results. C. Using the wrong needle size. D. Performing the wrong analysis. Answer A. Incorrectly identifying the patient. Pre-analytical errors include any errors that occur before the sample reaches the laboratory, such as incorrect patient identification or improper sample handling. How should a phlebotomist handle a patient who becomes agitated during venipuncture? A. Restrain the patient and proceed. B. Ask a colleague to assist in holding the patient still. C. Calm the patient and attempt the procedure when they are ready. D. Immediately call security. Answer C. It is important to calm the patient, ensuring they feel comfortable and safe before attempting the procedure again. What is the recommended action if a vein collapses during venipuncture? A. Continue with the procedure. B. Stop and apply pressure. C. Adjust the tourniquet to release tension. D. Withdraw the needle immediately. Answer D. If the vein collapses, the needle should be withdrawn immediately, and pressure should be applied to the site to prevent further injury. Which of the following is a sign of hemolysis in a blood sample? A. The sample has clots. B. The sample appears cloudy. C. The sample appears pink or red. D. The sample appears yellow. Answer C. Hemolysis occurs when red blood cells are broken down, giving the plasma or serum a pink or red appearance. What should you do if a patient has a seizure during venipuncture? A. Restrain the patient's arms. B. Immediately remove the needle and protect the patient. C. Call for emergency assistance and continue drawing blood. D. Finish the procedure quickly. Answer B. If a patient has a seizure, you must stop the procedure, remove the needle, and protect the patient from injury while calling for help. Which of the following is a potential complication of arterial puncture? A. Thrombosis. B. Phlebitis. C. Petechiae. D. Hemoconcentration. Answer A. Thrombosis, the formation of a blood clot, is a potential complication of arterial puncture due to the high pressure in arteries. What is the most common cause of hematoma formation during venipuncture? A. Using a butterfly needle. B. Inserting the needle too deeply. C. Failure to apply enough pressure after the draw. D. Collecting multiple tubes of blood. Answer C. Inadequate pressure after venipuncture can cause blood to leak from the vein into surrounding tissue, leading to a hematoma. Which of the following tests requires a fasting blood sample? A. Complete blood count, CBC. B. Basic metabolic panel, BMP. C. Glucose tolerance test, GTT. D. Blood culture. Answer C. A glucose tolerance test requires the patient to fast beforehand to accurately measure blood sugar levels. When performing a heel stick on an infant, where should the puncture be made? A. Center of the heel. B. Outer edge of the heel. C. Finger. D. Earlobe. Answer B. The recommended site for a heel stick is the outer edge of the heel to avoid injury to the bone, which could lead to infection or other complications.